Actually, I had a question that I wanted to ask that someone sent me earlier, which was around the importance of trust, for marketplaces. And I can imagine with power, it's increasingly important with people trusting you with their health and entering these trials. So how have you thought about building trust directly with patients?
Yeah, yeah. Well, in this vein, um, we've had to go pretty deep on the kinds of things we can and can't communicate about a clinical trial, because it is regulated. In theory, every piece of advertising, I mean, not in theory, in practice, every explicit ad you run about a given trial needs to be approved by an ethics committee, called an IRB, an internal review board. And so you have to be really conscious of how you're speaking about these things. Our approach has been to like try to really simplify information and then present it in a plain way for folks. So for example, we've got some work right now, and we've started to roll out simple bar chart comparisons of efficacy. For this antidepressant, it might be that in the first 60 days, people who are on it see their depression score drop by 20%. With this other antidepressant, it might drop by 35%. But then looking down below this, hey, antidepressant 2 also has more reports of insomnia. So our approach is really to present the data plainly and trust folks, to be able to interpret and choose what's best for them. And then we're increasingly trying to provide longer form resources for folks who want to get up to speed on what these different measures mean, and how the industry has moved over time. We're in a funny, I mean, depending on your marketplace, if people naturally already do a lot of researching, if it's like an important decision, we've been surprised at how many minutes people will spend scrolling through blog after like long form guide after long form guide. Um, so trying to weave those into the product has been helpful.